Washington's Mall, WMAL, where Washington comes to talk.
All right, let's go to the phones. Let's go to Mary Kay calling from Annandale, Virginia. Mary Kay, you're on the Chris Plante Show.
Hi, Chris. Thanks for taking the call.
You bet.
Yeah, I used to be in the modeling community, having gotten a master's in operations research from MIT.
Okay.
We do that kind of stuff.
Uh-huh.
And the first thing I want to say before I say anything is that all models are wrong. Some models are useful.
Say that again. Now you're an MIT genius, and you've worked.
No. I just got a master's, but it was in operations research.
In models and research, and you start out by saying, first of all models are wrong. But that's because they're all based on suppositions and hypotheses.
Absolutely. Now, the first time I have really believed anything, I believe what Dr. Burke says because she's wicked smart, and I understand what she's saying while she's saying it, but don't ask me to explain it to anybody later.
Sure.
But anyhow, the first thing that I saw, though, that helped me to understand what it really is that we're looking at was that one graph with the 100,000 to 240,000 deaths in the U.S.
Right.
And the reason why I appreciate that model is she said that it's continuously updated with the actual on-the-ground information. And so many of these models are so dependent on Chinese data and all kinds of other garbage that unless they're updated with data that reflects the U.S. population and reality, oh, by the way, I'm not going to believe them. So a continuously validated model, I think, is a really, really good thing.
And that's a word that she used a couple of times yesterday, validated, and she did talk about it being continuously updated. And you're, of course, right, it's the old garbage in, garbage out equation when it comes to what we're getting from China on what their experience has been, how many dead, how many infected. It's so gruesome that only communists could create a situation like this. But apparently they're estimating the number to be much, 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 much larger, maybe 40 times larger than what the Chinese have said.
Yeah.
Based on the activity of the crematoria, the plural of crematorium, because they're cremating so many bodies and they're handing out so many urns for ashes to so many Chinese citizens that they're estimating that they're concluding basically that what the Chinese have been telling us could not be relied upon, should not be relied upon. And then Italy is a different thing altogether. I love Italy. I love Italians. I love Italian food. I love everything about Italy. But when it comes to their healthcare system and the Italian attitude and a lot of things, if somebody 80 dies of pneumonia, also had the coronavirus, what are they putting down? And what kind of stats are we really getting from them, too?
Well, and Chris, there's another thing about Italy, and there were so many people who were afraid that if they went to the hospital, they'd die alone. That's why they stayed home.
Wow.
And infected all kinds of other folks. So, as you say, it's the attitude of the Italian people as well.
And also they skew, strangely, interestingly, it's the oldest country on average in Western Europe and perhaps in all of Europe. And I think the average age is 65 in Italy, if I remember this from an article a couple of weeks ago. And in the United States, the average age is like 38 and a half or something like that. So that skews the population. And so your base is a completely different base. Your starting point is completely different. And as you said, you have to model it based on what you know in the United States, because even the Italian model, forget about the Chinese model, but even the British model is not going to square perfectly with American models. So if you're constantly updating the data you're getting in the United States out of the hot spots and beyond, as a modeler, what's the conversation in your household about all this?
My cats have nothing to say about it.
Really? Your cats don't have anything to say. They're just... And it came out of there. But the planet is fighting this across Europe, across Asia, and in South Korea, and Japan, and in Taiwan, and lots of places. Then, of course, Italy, and at the area of Italy, there are a lot of Chinese laborers that have been brought in, liberals like to say workers, that have been brought in from China to work in plants and factories in Italy, in this area in the north, Lombardy, and the surrounding environs, because Chinese billionaires had come in and bought some traditional Italian companies, and instead of just running them like that, they moved lots of people in, and they had direct flights from Wuhan into Italy on a regular basis. And that helps explain that. Now, the death toll in Italy is much higher. It's higher than it is any place, if I'm not mistaken, at this point in time. I think they have 11,000 dead around the world now. We've got a total of 44,000 dead from the virus, about 185,000 recovered, more than 4 times, and we've got a total of 883,000 cases, they say, confirmed or presumed around the world. Now, yesterday when I came in, I said we had about over 3,000 Americans had died from this. Today, the number is over 4,000. It's over 4,000. About 4,090 is what the Johns Hopkins web page updating this on a regular basis has. 4,090 Americans dead. A total of about 7,100 have recovered. Now, that number is more difficult to quantify because you don't know how many people have had the virus and ignored it and gotten on with their lives and then effectively recovered from it over time. So that number is much softer. The number of deaths, that's a much easier number to quantify. And we have a total of 189, almost 190,000 cases confirmed or presumed confirmed in the United States of America. So it is, and look, yesterday it was about 3,000, a little over, I think it was 3,070 something. Today, 4,090 something. That means a jump of about 30% in 24 hours. Now, the epidemiologists and the virologists will tell you that if you continue to make leaps of 30% every day, now I think that leap is probably slower than some leaps we saw early on, where we jumped 100% in a day or 60% in a day. This leap of 30% is still not the direction you want to be going, but it may suggest a slowing. Now, I mean, you can't say that, but you can start to draw a trend line using dots and dates and things like that, and hope that this thing is going to end sooner rather than later. In the meantime, of course, it's very political. The New York Post yesterday, the headline is Coronavirus Deaths. The death rate much lower than previously reported, study says. Now, you may remember that the study that said 2.2 million Americans were going to die and 500,000 Brits or but let me get to this. The coronavirus may not be as deadly as previously suggested, according to a new study that accounts for cases that were not diagnosed. It's kind of what I was talking about here with the number of people recovered in the United States. How do you know if you don't know how many people were infected in the first place? The study, published Monday in the medical journal The Lancet Infectious Diseases, estimated that the death rate will be 0.66%, which is much lower than the figures between 2% and 3.4% that have come out of Wuhan, China, according to CNN. But you can't believe the Wuhan, China numbers because they're communists, so they lie. You can tell because they're talking. Researchers said the lower coronavirus mortality rates were determined by accounting for cases that went undiagnosed, possibly because they had mild or no symptoms. To do this, researchers used modeling. There's that modeling word again. But look, it's all they can do. Until you have the actual, number of dead rolling in, then you have something beyond modeling. But before you have the number of bodies to count, you have really nothing but modeling based on suppositions and so on. To do this, researchers used modeling based on the number of detected cases among repatriated citizens who were aggressively tested for the virus. But in line with other studies, the researchers found that the majority of fatalities are among adults who are aged 80 or older. And really, once you're over 50, you start to get into an increased danger zone. If you have asthma or other pre-existing conditions, those are factors that create increased risk for you. And certainly if you're over 60, over 70, over 80, over 90, risk goes up. When you enter those new categories. So you need to take extra care and be extra careful and keep people away from you and stay home and stay away from the dread virus. And we all have an interest in this, I believe. We have parents and grandparents and aunts and uncles and friends and neighbors and all of that. So we're responding accordingly. Now, at the same time, let me go to Michael.
I thank you from the bottom of my heart for sending them. CDC director downplays coronavirus models, says death toll will be much lower than projected. Gosh, if only there were a host who said so. One of the nation's top public health officials suggesting yesterday that because Americans are taking social distancing recommendations to heart, the death toll from the coronavirus will be much, much, much lower. That's three muches, folks, than projected. If we just social distance, we will see this virus and this outbreak basically decline. And I think that's what you're seeing. This is from Robert Redfield, the director of the Centers for Disease Control. I think you're going to see the numbers are, in fact, going to be much less than predicted by all the models. Well. Who'd have thunk it? The models were way out of line. And we were told just a week ago that we were going to hit 100,000 deaths minimum, even with mitigation, even with social distancing. As I told you, CNN's got the death count. They didn't even get to 1,000 deaths overnight. So we were at 10,000 something. Now we're just over 11,000 as I record this podcast 24 hours later. Damn it. So the death count is slowing. The hot spots are slowing, at least for now. Not to say there aren't other hot spots. Again, not to suggest this is over. Ventilators, sounds like we have plenty. Not to say there aren't shortages of supplies, and not to say there aren't hospitals that you can't find out there, individual anecdotal stories of hospitals that are strained. You know, it's interesting, that word anecdotal. Hydroxychloroquine is something that we're always told anecdotally. These are anecdotal stories of success, even though we've heard dozens and dozens and dozens of real-time success stories about hydroxychloroquine saving lives.
Why would you guys do that?
You're a military guy, and you know, with in military, there's planning, there are projections, there's what you think might happen or what could happen, what you hope will happen, and all those things. So you're familiar with modeling to some degree, I would guess. What do you make of, I talked to Julie Kelly during this show, and one of the things that Julie's got a real problem with is the modeling. Dr. Burke saying yesterday, she's confirming now that every death's a COVID death, whether it's tangentially related or not. Has modeling failed us here? Has that been overblown? They've got a new one that came out this morning that's got it now at something more like a bad flu season in terms of death. Do you have a problem with the modeling and basing our decision-making on modeling? Is the president weighing too much on modeling?
Look, modeling's always imperfect. This is kind of my argument about global warming. The reason that I don't feel compelled to accept the obsessions of, weird Swedish teenagers and conform my society to them. Because, these guys literally can't model today's stuff.
Yeah.
Today's, hospitalizations, intubations, deaths. And we're supposed to be, changing our society because of the weather in 100 years. I think we got to do the best we can. I think we'll learn from these. But garbage in, garbage out. If your data point is anybody dead who has or may have, exposure to the coronavirus as a coronavirus casualty, I think that's bad data. And we got to make sure we don't fall into the trap of thinking, oh, there really wasn't a problem because the steps we took to ameliorate the problem, may have worked. We don't know these things. I think we have to redo the data. We have to get the best data we can. We have to model as best we can and fix the formulas. And I think we have to do the best we can. I do think that the numbers are generally good. And I think that there is I welcome the pressure to reopen society. I don't know if today's the day to do it or next Monday or 2 weeks from Monday. But, about 3 weeks from today, I'm thinking, if I don't have a good reason 3 weeks from today, I'm really going to be having some questions.
Yeah.
The thing is, what we're seeing is some people who seem to have, I don't know if it's quite an interest in this continuing, but who don't mind it that much.
That's the vibe, Colonel. That's the vibe.
Those would be people who don't own small businesses like I do.
Yes. Yeah, there's a weird, I'm finding comfort with it. There's certainly a lack of urgency. I think a lot of critical people that have a national platform seem to express a terrible lack of urgency in returning to some sort of economic normal. And wouldn't you love to see cable news start to interview the small business person? Let's start having some profile.
That would be nice to see.
Yeah.
You know what it reminds me of is